Hello and welcome. So, big toe arthritis. When we had a quick look on Google Trends and what people are looking for, one of the most common things when people are searching with regards to osteoarthritis is big toe arthritis. What is it? And how do I know I have it? So, let's try and answer those questions for you. You're going to see why I'm a podiatrist and not an artist. Now, so let's try the optimum word here, draw a healthy big toe joint. It's not done, that phalanx is a little dodgy. So this is your metatarsal, your proximal phalanx, your distal phalanx. And this section here is called your first MTPJ, or metatarsal phalangeal joint. So if you look at on an x-ray, what you'll tend to find is a nice healthy space, and that's just because you can't see the cartilage on x-ray. So what happens then if you've got osteoarthritis? What we'll tend to see is that this joint space will narrow, and at some point you may get some bone touching. So we can see that joint space is narrowed, and sometimes we get some lipping of the bones here, and then you get what we call this osteophyte formation. And that's essentially what is osteoarthritis of the big toe. What people often think about osteoarthritis is one of the most common things that people think it is wear and tear. No, it's not. Because a lot of people think it's wear and tear because that means people think you can only get it if you're old. That's not the case at all. Yes, we know it's more common in older people, but it's not a disease process that is purely just for the old. We know that having a previous history of any trauma or injury to a joint does increase your risk of getting osteoarthritis. And what effectively happens is every time you load the joint, the big toe joint, the cartilage gets loaded, the body sends a message to the brain says, right, we need to send all the nice goodies down there to then grow more cartilage to keep the joint healthy. In arthritis, what happens is that message gets a little lost along the way effectively, and we're not replacing the cartilage as quickly as we're putting the load through it, so it starts to wear away and that joint space gets narrow. So, how do we know that we have osteoarthritis? Well, the beauty of arthritis, it does follow a nice little pattern. So, what you'll tend to find is you'll often describe the pain as an ache. It may be stiff. You may find the toe reduced motion through the toe itself. So they're the sort of things you'll tend to find particularly is anything that is bending the toe upwards will tend to aggravate the joints. Now, we will do more videos around about treatment of this later on, but essentially that's how you would know you'd have it. So, something else also to keep mindful of is I'm going to draw a toe joint again. The amount of times I've drawn these, you'd have thought I'd be better at it by now, but hey hey. So, one thing you can have is you can get what we call some osteophytic lipping. So if we sort of think, if this toe joint is going to bend up here, this bit here has a potential to knock and rub and reduce that range of motion through the toe. Sometimes you can get that and actually you don't have much arthritis because the joint space is preserved quite nicely. So sometimes if you get that small bit of lipping, that doesn't always mean you've got arthritis. Sometimes what you do see though, with people who have osteoarthritis of the big toe, and quite commonly, is when you look at the toe, you look at the skin, you see around here that it's just like this sort of extra lumpy bit present, and that lumpy is hard. Well, it's hard because it's bone, and it's what you call this osteophyte formation. And so what's happened is, as the bone has been loaded, because this joint space is now much narrower, every time you cause trauma to that bone, the body will try and grow more bone to protect it, and it's quite often that you then see that lump forming. And sometimes actually people try and confuse that lump and they try and keep it as a bunion. So some people think they've got a bunion when they haven't got a bunion, they've actually got arthritis of the big toe joint. So hopefully that's a little bit helpful around about what big toe arthritis is and how do you know that you have it, and we shall see you all soon. See you later. Bye.